Now to our health headlines, and we begin with a question: what is an essential tremor? That's what we'll be exploring this morning. We're talking about a new non-invasive treatment option for essential tremor and other conditions. Joining us this morning, Dr. Zion Zibli, Associate Professor at the Yale School of Medicine. Doctor, thank you very much for being with us this Friday morning. Let me start with the obvious question: what exactly is essential tremor, and how is it typically treated?
So essential tremor, I wouldn't call it a disease, I would call it a disorder. It's sometimes genetic, sometimes it's not genetic, sometimes it's sporadic. I would say 50% genetic, 50% sporadic. Basically what it does, it causes tremors of the upper extremities and head. So it's mostly a disorder that inhibits people from doing things with your upper extremities, like severe tremors.
Very good. What can you tell us about, is it called the HIFU procedure that you actually helped to pioneer?
Yes. So, until a few years ago, the only way to treat essential tremors was to do surgery, brain surgery, with implanting of electrodes in the brain. A few years ago, I was happy to be part of the team who developed a machine which is called HIFU, High Intensity Focused Ultrasound. It's a new machine that is FDA approved already. And we can stop the tremors with a non-invasive procedure. Basically, it's an ultrasonic wave-based machine. We do a small lesion in the brain that stops the tremor. It's done as an outpatient procedure. The patient comes in the morning. After 2 hours, he has no tremors and can go home. A life-changing machine.
Doctor, what's the typical cause of this disorder? Is this something that's genetic with a person, or how is it developed typically?
So we do know that around 50 to 70% of the patient have a hereditary disorder. And if you go back and track the family, you will notice that few members of the family had tremors in the past. But about 30 to 50% of the patient have sporadic tremors. We don't know exactly why. We don't know the gene exactly. It's a movement disorder. So if you look at the genes for Parkinson's disease and tremors, they're almost the same. But it's not exactly as Parkinson's disease. It's only tremors without all the other manifestations of Parkinson's disease.
If you know early on that you might be at higher risk, is there anything you can do about it at that point?
Unfortunately, no. There's no treatment for essential tremors. We can only treat the symptoms.
Okay. Now, HIFU that you talked about earlier can be helpful for more conditions beyond essential tremor. Who else can that treatment benefit?
So for essential tremors, we can stop the tremors in about 92 to 95% of the patients. For patients with Parkinson's disease who have tremors, we can stop the tremors at around 90%. So the machine, the HIFU treatment, is suitable also for Parkinson's patients with tremors.
Dr. Zibli, thank you very much for being with us this morning, and continued success with that great work.
Thank you so much. Good morning.